If your period has become so heavy that you plan your life around bathrooms, extra clothes, or fear of bleeding through, I want you to hear this clearly. That may be common, but it's not something you have to normalize. Fibroids are one possible reason, and today I'm going to show you 10 signs that it's time to ask about them. If you appreciate clear, patient first answers about fibroids, gently tap the like button. Let's get into it. Fibroids, also called leiomyomas, are benign growths that arise from the muscular wall of the uterus. Benign means they are not cancer. They can be tiny or they can grow large enough to change the shape of the uterus. Their location matters. A fibroid that bulges into the uterine cavity may cause a very different set of symptoms than one on the outside of the uterus. Some people have fibroids and never need treatment. The problem is not the fibroid. The problem is when symptoms, anemia, pain, pressure begin taking your life over. The first signs The first sign is bleeding that is much heavier than your usual pattern. That can mean soaking through your pads or tampons unusually quickly, passing large clots, bleeding for more days than you're used to, or arranging work and travel around your cycle. The second sign, the second sign The second sign is feeling wiped out. Heavy blood loss can contribute to iron deficiency anemia, which may feel like fatigue, shortness of breath with activity, dizziness, headaches, or a pounding heart. Do not self-diagnose anemia from a video, but do ask for a blood count and an iron assessment when heavy bleeding is affecting your energy. Sign 3 through 5. When something feels like it's pressing on everything, is pelvic pressure or persistent feeling of fullness. The fourth is needing to urinate more often because a fibroid may press on the bladder. The fifth is constipation or pressure towards your rectum. None of these symptoms automatically proves fibroids. Bladder conditions, bowel conditions, pregnancy or ovarian problems, and other gynecological issues can overlap. But when several of these symptoms travel together, especially with heavy periods or pelvic evaluation becomes important. Signs 6 through 8. Pain, discomfort, and changes you can see. The sixth sign is pelvic or lower back pain that recurs or worsens around your period. The seventh is pain with sex, especially when it's new or persistent. The eighth is a lower abdominal enlargement or bloating that does not behave like ordinary day-to-day bloating. Fibroids can make the uterus larger, but a swollen abdomen always deserves a thoughtful assessment rather than a guess. A clinician may use a pelvic exam and imaging, such as an ultrasound. MRI can be useful in selected cases when more detailed mapping is needed. Lastly, signs 9 and 10. These are reproductive questions. The ninth sign is trouble with fertility or repeated pregnancy complications. Fibroids do not always cause infertility, and many people with fibroids become pregnant. But the size and location of the fibroid can matter, particularly if it changes the uterine cavity. The 10th sign is simply this: you have been told you have fibroids and your symptoms are getting worse. You do not need to wait until an emergency to revisit the plan. A symptom diary can make that conversation much clearer. What to track before an appointment. For 2 or 3 cycles, track when bleeding starts and stops, how often you change protection, clots, pain from 0 to 10, missed work or activities, bathroom symptoms, and medicines you've tried. Bring any prior imaging reports, not just a memory that was once said you had a small fibroid. The question is not only do I have fibroid, it is are fibroids likely driving these symptoms, and what options fit my life and future goals. The evaluation is not a one treatment conversation. An evaluation may include pregnancy testing when relevant, a blood count, a pelvic examination, and an ultrasound. Depending on the age and bleeding pattern and history, other testing may be appropriate. Treatment can range from observation and medication to procedures or surgery. There is no prize for choosing the most invasive option, and there's no prize for avoiding treatment when symptoms are harming your health. The goal is informed, individualized care. Now, let's make this practical. Imagine a patient who says, my periods have always been heavy, so I thought this was just how my body works. Then she mentions she is changing protection every hour on her heaviest day. She keeps a spare outfit in her car. She's too exhausted to exercise. Those details are not embarrassing side notes. They are clinical information. They help us understand severity and the impact of the quality of life. Another patient may have less bleeding but feel constant pelvic pressure and use the bathroom every 30 minutes. Her symptoms are different, but they still deserve an evaluation. The goal is not to compare who has it worse. The goal is to identify what is disrupting your life and why. It's also helpful to know what an appointment should not feel like. You should not leave with only the sentence, you have fibroids, and no explanation of whether they explain your symptoms. You should understand whether a blood test is needed, whether imaging has answered the important questions, and what treatments are reasonable, and what the follow-up plan is. If you choose observation, if you have a history of heavy periods, but your symptoms suddenly change, that is another reason to call. A change in pattern can matter as much as the symptoms you have had for years. And please remember that online symptom checklists have limits. They can help you find language for what you're feeling, but they cannot replace an exam or imaging. Use this list as a starting point for a conversation. You do not have to convince anyone that your symptoms are real. You just need a care team that takes them seriously and helps you understand the next appropriate step. Before we move on, here's the conversation I want you to have with yourself after watching this. Do not ask only whether your symptoms are bad enough. Ask what they are costing you. Are you missing work? Are you avoiding exercise, travel, intimacy, or time with family? Are you buying more products, changing clothes, or feeling anxious every month? Those are real impacts. Write them down. A symptom diary is not about proving you deserve care. It's about giving you and your clinician a clearer picture of what has changed and what you need from treatment. If you're unsure whether to schedule an appointment, start with your primary care doctor or gynecologist. Tell them exactly what has changed. If heavy bleeding is causing severe weakness, dizziness, fainting, chest pain, shortness of breath, or you're soaking through protection at a concerning rate, seek urgent medical guidance. Do not wait for a video or routine appointment to tell you what to do in an emergency. The goal is early evaluation, not anxiety. Most importantly, remember that a diagnosis of fibroid is not the end of the conversation. It is the start of a plan. Before we continue, if this is sounding familiar, please do not assume you have to simply live with it. A good next step is a proper evaluation with your gynecologist and, when appropriate, a fibroid specialist. At Vein Health Clinics, we review symptoms, imaging, and your goals and the full range of options. The purpose is not to push on one procedure, it is to help you make a decision you understand. Use the consultation link in the description or call our team to find out whether an evaluation is appropriate for you. In conclusion, heavy bleeding, anemia, symptoms, pressure, bladder changes, and pain are not things you should have to simply tolerate. A focused evaluation can turn a vague concern into an actual plan. Fibroids are very common, but suffering in silence should not be treated as normal. The right plan depends on your symptoms, the number, the size, and the location of fibroids, your health, and what matters most to you now and later. If this video helped you ask a better question at your next appointment, please share it with someone who may need it, and subscribe for practical evidence-led answers about fibroids and minimally invasive treatments. This video is for education and it's not a personal diagnosis or treatment plan. Heavy bleeding with dizziness, fainting, chest pain, shortness of breath, severe sudden pain, or possible pregnancy symptoms needs urgent medical care.